to Instagram Live. What's up? I am Dr. Jordan Feigenbaum. Also, if you're on YouTube, we're doing this Q&A thing. It's Friday, September 14th. I'm killing an hour or so before I go up to the Bay Area. Well, I guess I'm in the Bay Area. But until I go up to catch a flight to Hawaii with Baraki, we're going to go check this CrossFit level 1 MD thing out and see if we can't get in the game. So anyway, happy Friday, everybody. Hope everyone had a good week. Mine was a mixed bag, but training was well. Training went pretty well, so that's good. If you're just joining us for the first time, we do these like live stream question and answer things where I answer your questions, and it's a good time for everyone. What's up, Sam? How you doing, man? Yeah. I'm trying to think. Oh, yeah, newsletter went out today. So if you haven't signed up for a newsletter, head over to the website. You can join 55,000 other folks or so who got our latest newsletter with the latest information. Trying to get some more content out before the weekend, before we go to Hawaii. But there you go. Let's see. Is ezetimibe a mediocre drug for the same reason that dietary cholesterol is not a culprit? I don't know if I would say that ezetimibe is a mediocre drug. I think it has incorrect and correct applications depending on the presentation. So I don't know if I would actually agree with the premise of that. Yeah. So which program do I use? I use, well, Mike Tushira actually does my programming, but is very similar to our Barbell Medicine programs. So right now it probably most resembles like 12-week strength program. Yeah. How would you advise coaching someone with kyphosis and little upper back mass in the squat, specifically bar position on the back, just whatever they can get? I actually had a client with Scheuermann's kyphosis, so it's a fairly significant anatomical kyphosis versus a volitional kyphosis. So people who round their back or have, slouched posture, and it's volitional, meaning that they can basically correct it. Those folks you don't really have a problem with. The people with the kyphosis that is anatomical, sometimes you can't get them in a low bar position, and if that's what you wanted to use, this might not be a great idea. Other folks who have that same problem can't do a high bar squat, and so then you would do the low bar in that instance. And if they can't do either, maybe you switch to something like a safety bar squat, or use a top squat, or even a front squat. Yeah, top squat attachment can be useful to getting people to squat, because getting people to squat is what you really want. You don't really care if someone's low barring or high barring. You just want them to squat, and you want them to squat well, repeatedly, consistently, and that's trainable for them. That's what you want. So the other thing that people will say is like, oh, I'm going to try to correct their kyphosis. It's unlikely you're going to correct an anatomical kyphosis. When I say unlikely, I mean, nearly impossible. Volitional kyphosis, if you can get a person to volitionally want to stand up straight more often, well, sure, but there's nothing good or bad or, whatever. So, all right, from the tubes, let's see, Chris Dunez, I can taste the science in your Whey RX. There you go. Each scoop loaded with 20 grams of high-quality science. Let's see, hi, Doc, tips for lowering triglycerides and cholesterol. Yes, that depends what the reason is why. If you're overweight, losing weight generally will help. The decreasing intake of sugar, increasing fiber intake, particularly those from whole grains, and decreasing intake of foods that are high in saturated fat, and regular exercise, stop smoking. Those would all help. If you have familial hypercholesterolemia, then you probably have to take medication. So, yeah, there you go. When you come back to Australia, we are going to come back in February. Yeah. Let's see. ADC 126. I get bicep pain. You get biceps pain. You don't get bicep pain. You get biceps pain. Yeah. With bench press, but not curls. My biceps fatigues before I even feel it in my chest. Any ideas what could cause this? Sure. Biceps tendonitis. Long head biceps tendonitis. It's a shoulder issue. Yeah. Less likely an arm issue, unless you have like a huge space-occupying lesion in your arm. Yeah. If I eat 1 pound of meat every day, do I need 5 grams of creatine, or can I singe that I'm getting 2 grams from beef? Well, one, no, you can't assume that you're getting 2 grams from beef unless you are in fact getting 2 grams from beef. I don't know offhand. I think it depends what cut of meat you have. And then 2 grams is not an ergogenic dose, meaning it's not a performance enhancing dose. So if you were trying to take creatine to increase your performance, your dose is too low, bruh. So nay, Nay. Why do powerlifting meets have you pause the bench but don't make you pause the squat? I don't know. It's just, any sport really is just a collection of contrived rules that everyone agrees to play by. So why is there a start command on the squat in some federations and not a start command on the bench press? I don't know. I don't know, man. Let's see. Do the 3-day and 4-day hypertrophy templates have different volumes? Yes, they do. On the bridge, can you substitute the overhead press with a push press? Can you? Sure. I probably wouldn't, but you can. There you go. Hey, Jordan, any advice on training post wisdom teeth? Just got them out today and wondering how long till I can get back to training. You should listen to your surgeon on that. The main thing is going to be not wanting to get dry socket and not wanting to bleed a bunch. So if you have a bunch of sutures, if you had impacted thirds, so impacted wisdom teeth, and they had to cut them out, you're likely have a little bit more time off, just so you don't rupture the repair and bleed out, in your mouth, which would be bad. Dry socket's also no good. So that being said, I don't know. If it were me, I'd probably get back to training within a week or two, and if not on pain medications, all good things. Yeah. What's up, Blake? Howdy. Halfway through the 12-week strength template, making great gains, but elbows hurting a lot during press and bench. Any recommendations? Sure. Make sure you fix your squat grip. Make sure that your technique on the bench and the press are also good. And then reevaluate. Yeah. When you say 1-inch deadlifts on Bridge 1.0, what? I don't say 1 foot deadlifts. I don't say that at all. 1 foot from the floor or with 40-pound plates. I don't actually know what you're talking about, dude. I don't say 1 foot anywhere. Brendan McCoy, do you think it's important to teach a Valsalva to a novice? I think it's important that everyone knows how to do a Valsalva if they're lifting weights. Yeah, you're going to do it anyway, but to do it correctly with the most amount of, as my Hebrew friends would say, chutzpah, you should probably learn a little bit, The evidence for ice baths is mostly non-existent. What do you think about cryotherapy for recovery? I think that, on balance, the evidence suggests it is not effective for improving objective performance or even subjective ratings of fatigue, or like perceived fatigue or DOMS. And I think that it costs money, takes up time. The only thing like cool therapy would be useful for is if you had to compete multiple times in a day and your core temperature was elevated after the first competition. Yeah. All right. Oh, LOL. What's up? Presuming your novice programming differs from starting strength LP, are your current philosophies on novice programming documented anywhere? They're documented in various different places, including different podcasts, live streams, interviews, different places on the internets, but they're not compiled in one place now. Yeah. Let's see. Hey, Jordan, I have my first meet tomorrow morning. I've been following a 12-week strength program all summer. Have seen great improvement. Hey, that's awesome, man. Kill it. Good luck, Luke. Let's see. Do you think Herbalife is a good supplement company? Nope. If not, can you provide your reason? Yes. All of the supplements that they make are substandard or snake oil. So, there you go. Jordan, can you explain how a lifer can or should see progression? Well, every day you get 1 day older. And so when you're on your linear life progression, you just take it up 1 day at a time. I think that answers the question. Let's see. Happy Friday. Any effect of Propecia treatments, specifically finasteride, on strength recovery? Not that have been documented in the literature. Nay. When will Barbell Medicine release a novice program? I think, I've been working on it a lot. I don't know, man. I was hoping to have it done before this weekend, but, that's what I get for hoping. How can you correct knees that wobble or lean in when doing a squat? Oh, you can coach them. You can change the position of the feet. You can change the movement pattern. You can lighten the weight. You can change where the bar is positioned. You can do a bunch of stuff. Try coaching first, though. Coaching first. Yep. In terms of waiting 3 to 5 hours between meals, how much do you need to eat to constitute a meal? As in, if I had a meal, then three biscuits, I assume that you mean cookies, 1 hour later, would my next full meal be compromised? From a muscle protein synthesis standpoint, I mean, probably not, unless there was a significant amino acid component in the meal. The thing is, not fasting between meals is a problem. So I generally am anti-snacking unless somebody needs to gain weight. Yep. I drink caffeine that isn't from coffee. How bad is this for my telomeres? No one knows. Should I even worry about my telomeres? No, because you can't do anything about them. So, is green tea extract bad for the liver? No. As far as I know, it's not even metabolized by the liver. So, there you go. Hey, Doc, do you use a straight razor? I do. I straighten that. Or not straighten it, I sharpen it. Usually about once every 2 weeks. Get my strop out, my rubbing compounds. Yeah. Any different cues you would use for a deadlift bar versus a stiff bar? I would not. I would just practice with the bar I was going to use and get better at it. There you go. Is shrugging at the top of the press useful for anything? No. It doesn't impinge shoulder. It doesn't prevent shoulder impingement because the shoulders aren't impinged. So there you go. How can Skippy say no trans fats on the label yet list hydrogenated soybean oil on the ingredients? I think if it's less than 1 gram, you can say there's there's nothing. It's not in there. I think that's what it is. It's something like that. It's either less than 1 gram or less than 1% or something. Yeah. Jordan, my father was just told that he has dementia. Is there anything out there with good evidence to help delay it or make it better? Something we can do? Thank you. I think the best evidence has to do with. I mean, again, depending on which type of dementia, but overall, you're talking about a good social circle, actively engaging somebody regularly in some sort of goal-directed task where they have to think through things, using reminders to keep them able to do their activities of daily life, exercise. You would like it to help, but I don't know if it's that great. I'd still encourage people to exercise because I think it's better for just overall health. And I don't know if there's a lot that you can do. Certainly not supplements or medications that are terribly great, but sometimes they make the medications later on in the course can make a big difference. Yeah. Do you agree with if it fits your macros? Some of it, yeah, sure. Yeah, I agree with the idea that calorie balance is the number one thing, which is true. Let's see. I have a young client who's near underweight. His BMI of 18 means he is underweight. Plays junior football. His goal is to build muscle, and he's got crazy high activity level and hasn't been able to gain much weight. My suggestions are that he gains weight via increasing his calorie intake. Can I replace squats with overhead deadlifts on the 12-week strength program? Yes, that would be excellent for Mark the Ripper Toe. Nice. All right. Have the 4-day hypertrophy template. Some weeks I won't be able to lift 4 days. Can I put the exercises from the 4th day across the 3 days to work around the schedule? You could, sure. Yeah. Daily fruit veggie intake is not a question. That's just a statement with a question mark at the end. There was that Improve It trial that showed low efficacy of ezetimibe for a bunch of outcomes, but I didn't consider the potential indications beyond it. Yeah, I mean, usually ezetimibe's not used first line. Usually. It's usually adjunct treatment. I think there's some data that's suggesting that it, along with a statin, plus or minus niaspan, anyway, it gets pretty complicated. And I don't know if I would just say that it's because cholesterol doesn't matter, because dietary cholesterol can matter, especially if you have familial hypercholesterolemia. Who was your favorite character in Gates of Fire? I actually didn't really like that book that much. Yeah. It's been a while since I read it, so I don't know if I could tell you of my favorite character in it, but I read it. Yeah. Let's see. Thoughts on creatine for depression? I think there's one study suggesting that creatine it's either Paxil or Prozac. I forgot which one it is. Maybe it's one of the other ones. Was better than that same SSRI and placebo, but I don't think creatine on its own for depression does much of anything. Yeah. What is something that you and Austin disagree with, if anything, in regards to training? I don't know if we have any really big disagreements. Yeah. 3-day hypertrophy followed by 4-day hypertrophy followed by 12-week strength seems. I'd probably split them, to be honest. I'd probably put 12-week strength in between them. Yeah. I found a whey isolate called Muscle Feast that only has 4.6 grams of BCAAs per 20 grams of protein, but it's also GMP certified. Is it potentially not good protein? I mean, 4.6 grams of BCAAs is probably like 2 grams of leucine and then a little bit of isoleucine and valine. That seems reasonable. It's weird that it's an isolate, though. Yeah, it just means that what they say is on the label is in there. It doesn't mean that it's not adulterated whey protein, though. Yeah. Jordan, any comments on scoliosis and training? It doesn't matter. Yeah. Yeah, I don't think that you can fix it. I don't think that the scoliosis causes pain in your back either directly. So I probably wouldn't do anything about it because of the scoliosis. Now, if someone's got back pain and you need to manage around the back pain, well, that's a different deal. But I wouldn't do anything based on scoliosis. Doc, I have a friend who was told that by his myofascial therapist that her knees were not made for squatting and that she should just jump rope instead. What? Yeah. I don't know about that. Your knees weren't made for anything. Other than us being bipedal organisms so that we could reproduce faster, secondary to our different hip structure, so we could get out of the trees and onto the savanna and reproduce faster. That's why you have knees like you have, like we do. So. The bigger question is, why is your friend seeing a myofascial therapist? I think you have bigger problems to work with there. Yeah. Any evidence on the impacts of cracking your joints? Only that it doesn't mean anything. Yeah. Is the mercury level in canned albacore tuna worth worrying about? I think if you're not a pregnant female, no. Even if you are pregnant, I don't know if that's something to worry about, but I wouldn't worry about it. Yeah. Does vitamin D supplementation cause kidney stones? It can. I believe the number needed to harm is like 1 in 30 is 36. Yeah. Do the benefits outweigh the risk for someone who does not routinely get sun? Not unless you're over the age of 65 and you're institutionalized, in my opinion. Yeah. Or your vitamin D levels are very low. So, how do you cue bracing in the deadlift? I usually don't. Yeah, people will do that on their own. Do I ever purposely pop any of your joints? Only when I'm listening to 2 Chainz and French Montana. And French Montana tells me to pop that, and then I do. Yeah. Tom Capitelli says he lifted weights today. Oh my gosh! We got a CrossFit Games athlete, Sir Tom Capitelli. Can caffeine worsen performance? Sure, if you take too much. Yeah. Yep. I have scapular winging on my right side. That's unlikely. Does this cause hypertrophy differences across your chest? It's unlikely. Should I add volume to the affected side? No. If you have a nerve injury, then that would cause all of that stuff. But if you don't, then that's not what you have. But if you have a nerve injury, adding volume is not going to help. Letting the nerve injury heal is going to help. Yeah. Hey, Jordan, keep up your awesome work. Do you have any tips for dealing with hand calluses? Yeah, use a pumice stone in the shower. Yeah, there you go. In the squat, what is the position of the pelvis? Connected to your spine. I mean, if you go anterior pelvic tilt, you contract your erectors. If you go posterior pelvic tilt, you have a little more depth because of hammers. I don't know what the hell any of that means. Your pelvis is not it's neutral, if anything, but your erectors are contracted and so are your abs. Yeah. Competitive powerlifting while in med school is even remotely possible. Sure. I had a top 20 all-time total while I was in med school. Totaled 1795. I was a 198-pound lifter, which is now not top 20 and is fairly pedestrian, but sure. If you're a good powerlifter, you'll still be a good powerlifter in med school. You can make time for what you want to do. That's how life works, right? You get 168 hours in a week, and whatever you deem important, you will do it. Even if what you deem important is not doing anything at all, you will find a way to not do anything. And then if people get upset with you because you haven't made time for them, and then your response back is, well, I'm so busy. It's like, well, sure, you're busy doing things you actually wanted to do. So instead of telling people, no, I don't have time, you just say, nah, I'm not going to make that a priority. This is really how that goes. So in med school, if you want to be a powerlifter, you got to make it a priority. That's it. Fred White says B&R bar or Ohio Power Bar or any other bar for the first time buyer. Well, I think if you're in that price range, then I'd probably get. I don't love the Ohio Power Bar unless you're going to be a competitive powerlifter. If you're not going to be a competitive powerlifter, I like the B&R bar a little better. I like the Texas Power Bar better than both of them, as long as you're not going to do cleans, power cleans, or snatches, or front squats. And then if you got a bunch of money and you are going to be a competitive powerlifter, I'd get the Alico competition bar. Yeah. Caleb Wochnik. I've heard that fatigue is necessary for gains, but I've also heard that programming should minimize it. That's not possible. Those two things are antithetical. Is it good or bad? You need fatigue. Fatigue needs to be generated by stress to cause the adaptation. If there's no fatigue, there's no adaptation. Can you have too much fatigue? Yeah. Yes, you could. Too much fatigue that doesn't cause the fitness adaptations that you're seeking, or causes them in the period of time that is incorrect for certain outcome that you want, like a meet, like going to a powerlifting meet, that would all be bad. Sure. Vegan Gains wrecking Jeff Nippard about cholesterol. Thoughts? Jeff Nippard, not a doctor, not a research scientist, but I think he's a nice guy, and I'm glad he's putting out good information. It's what I reasonably assume to be good information. Vegan Gains, I don't care about. Yeah. Sweet. How do you maintain your beard lines? I have a small human, who carries around my straight razor and hooks me up. Yeah. Why is snacking a problem? If you want to stay as lean as possible while gaining weight, would you recommend not snacking? Not snacking. I think that you need to have periods of time where you're not eating to allow postprandial processes to occur. And I think wanting to remain as lean as possible, I think there's so many problems with that, just in general. So let's just move past it. But I think that you should have your meals in discrete times, and then between those meals, you should not eat. That'd be the goal. I asked the question about the underweight football kid. I've tried many strategies to get him to increase calories. He does not listen, and his mom freaks out about the idea of him becoming fat. Help. There's no help there. There's nothing. You can't fix people who are not willing to do the things that it takes to achieve the outcome that they say they want. And you're fighting his mom. There's nothing you can do there. You're not responsible for that. Excuse me. If his mom asks, about him getting fat, ask her why does she think that's going to happen? What are her fears? Maybe you can allay them. Cheap alternatives to assault bike, rower for steady state GPP. Regular bike, two shoe express. Yeah, you could walk, run, jog, stuff like that. Yeah. Am I tuning into the Rogan pay-per-view between Norton and Dom? No, I'm not. I'm not going to watch it. Other than the standard cautionary approach, would you adjust training at all post coronary bypass? No, not necessarily. Unless my doctor told me different. Cheers. Why are you stupid? That's a tough question to answer. I think that, I've been trying hard my whole life to be stupid. My parents were stupid. And then, we've just been living that stupid life, man. I don't know. More importantly, why are you on a stupid person's Instagram live? That's the real question. Because if I'm stupid, but then you're watching, what does it say about you, Gabe? I don't know. Jordan, sorry if you answered it or covered it, but I didn't catch it. CBD oil for depression and energy levels. You've seen mixed views on it. You have not seen mixed views on it that are based in evidence. The evidence at this time suggests that CBD oil, even pharmaceutical grade cannabinoid products, are not useful for depression, mood disorders at all. In fact, they likely make them worse, if anything. And increasing energy, there's no effect. If anything, it'll make it worse. Do I see a potential to have Barbell Medicine affiliated gyms in the future? No. It doesn't mean it won't happen, but I don't necessarily see that. Yeah. Whew. Is what Rip said true, that you can't significantly increase your vertical jump? You can increase it, by statistically significant means. 20, 30% maybe. maybe a little more. But outside of that, unless you lost a ton of weight and got much stronger, yeah. My husband is insistent that I can build muscle and strength on a diet of 75% fat, 20% protein, and 5% carbs. I don't agree. I don't think that that is good for health or for improved performance or increasing lean body mass. Yeah, none of that. Do I have an opinion on postmodern philosophy and how it views modern science? Nope, not really. Does lifting increase risk if you have an inguinal hernia that is not reducible? If you have an inguinal hernia that is not reducible, you need to have surgery. Yeah. Do I miss Uncle Rip? Um, you know, no, not really. I think that we had some good times, and sometimes I think those were. I miss some of the earlier times, but recently, nah. Jordan, would you ever recommend foam rolling? If it got you a date, maybe, sure. If your question is going to be, hey, Jordan, I have this physical problem, expect the response to be, that's not a thing. Sometimes, unless it is a thing. Unless it is a thing. Yeah. Favorite type of sandwich is either going to be brisket sandwich, or pastrami sandwich, or peanut butter and jelly, for sure. The OBX life. Hey, dude, hopefully you're safe, man. Getting out of the OBX. Yeah. Jordan, just want to say you're the man. Thanks for all the great material that you and Dr. Rocky are putting out. Hey, thanks, man. First year DPT school, I'm trying to get in the habit of reading and analyzing research, trying to read at least one article per day. Tips on creating more depth, understanding, and not just reading. I mean, I would say read as much as possible. And ideally, you'd form a small group of people where you guys would bounce ideas off each other and have like your own little journal club. Yeah. Is there evidence of a link between Monsanto's Roundup and developing cancer? No. Ooh. That green rogue tea, very nice. A plus. Thanks, man. Trying to be fancy. Have you ever had a client go down in strength? Yes. You adjust programming in that situation. Ooh, what is the proper time in between meals to eat again? 3 to 5 hours, usually my recommendation. Squat racks at my gym are too low or too high for pin squats. No, just do them like an inch above parallel. That's fine. You can do them. If you can't do them at all, do pause squats. When do you do your lifting during residency? I was training all over the place. I was training at like 11 p.m. or when I was on overnights, I would train before I went to the hospital. Yeah, just got it in, man. When do you expect a restock of Barbell Medicine shirts? I think they're being printed right now. So, there you go. A lady told me that she had emergency surgery due to a synovial cyst pressing on her spinal cord. 2 doctors told her it was due to lifting weights. I told her about you guys and prayed for her. It's definitely not from lifting, but I'm glad that she got the care that she needed. Yeah. Am I still associated with Starting Strength? No. And I am not on good terms with Mark Ribito. No, not. Yeah, unfortunately. Mandy Lee 13, a regionals CrossFit Games athlete. What's up? Do you have any suggestions for increasing ankle mobility? Well, what I would say to that is increasing ankle mobility for what application? Because sure, I could increase your dorsiflexion and plantar flexion that you would have in certain positions. But if those aren't the positions that you're needing more ankle mobility in, then it would be for naught. So I would say if you need more ankle mobility for squatting, those are best attained by squatting. So that's what I would do. If, in fact, you need more ankle mobility, which you might not. Primarily squatting. So, yeah, more squats. There you go. Hey, Jordan, does medication like Ativan and Restoril affect gains? Not that I know of. Except for, altering your drive to train, perhaps. Beta-alanine, HCl, has the same effects as regular beta-alanine. I don't know if I could say that for sure. Yeah. In general, how many consecutive weeks should I do a variation before switching to a different variation? I think that depends. If you're seeing good results from one variation, I don't know if you would stop doing it until you stop seeing results from it. Jordan, it seems as though most protein powders contain stevia as a sweetener. That's not true. Stevia is much more expensive, like $150 a pound for stevia sweetener compared to $3 or $4 a pound for Ace, like Ace K and stuff like that. You can't seem to find whey protein that's unsweetened. Are there any negative health impacts to stevia? No, not in my opinion. And there's plenty of unsweetened proteins out there that just taste gross. Yeah. Is A&W better than Barks? That's a great question. I actually prefer Barks, but A&W, I think when you actually look on like the top 100 root beers, I think A&W is like number one. Yeah. Recommendations to rehab from partial bicep tendon tear from unilateral farmer's carries. I wouldn't do anything to rehab that other than slowly re-enter training. Partial tears, what are you gonna do with it? You know. I'm in the Marine Corps currently. Weird situation. I weigh 175, but my max weight for the Marine Corps is 180 until they start taping you. Yeah. Any suggestions on getting stronger but ensuring I stay within my limit? Well, if you can't gain weight, absolutely cannot 100% gain weight, well, you need to keep your calories down such that your body weight doesn't increase. But if you train, you're going to get stronger via improved coordination, muscle strength, etc. Perhaps not as quickly as if you were able to gain weight and gain more lean body mass, but yeah. Why do you think there's so much federal resistance to kratom? Is it necessary? You're enlightened by Netflix documentaries. Jesus. Netflix documentaries made by the Bell brothers are not actually, they should be called mockumentaries. Kratom's got a lot of problems with it, including the known side effect profile of it, the purity of the different plant products, the clinical trials showing not very pleasant side effects and not very great effects. It's just science deniers, man. So, are you still practicing medicine in a traditional setting? Nay. If not, how would this affect your credibility over time, if at all? I don't know if it does. Yeah. Yeah. I think if you were asking my opinion on things that were related to long-term medical practice experience, then, like how to run a medical practice successfully while accepting Medicaid, Medi-Cal, stuff like that, then I wouldn't have any insight. If you're asking my opinion on how to get people to train or what's the correct exercise recommendations for gen population or how to communicate nutrition recommendations effectively or how certain medications interact with exercise or pre-exercise screening tools, stuff like that, how to educate physicians on exercise nutrition, I think those things there's no bearing, or my current clinical practice has no bearing on those things. Dr. Sean Baker just got a coronary artery CAC score of 0. Thoughts? That's good for him. Doesn't mean his carnivore diet did anything. It's a huge genetic thing there as well. Also, how do you know that he actually got a CAC score of 0? He advertised it on the internet. Do you think he would advertise if it was something worse than that? Yeah. Let's see. When people say metabolic stress drives hypertrophy, what does that mean? That stress creating fatigue within either interset or intraset can increase motor unit recruitment. Sure. Yep, there you go. Will rubbing one off... Oh, good, this is a good one. Will rubbing one off as soon as you wake up impede you from training effectively if you train early in the morning because of the drop in testosterone after ejaculating? So none of those things are actually true. Yeah, so... Asking questions about jerking off on the internet, however, will definitely make you weaker. That's actually scientifically proven. So there you go. How do I tell my starting strength coach that I want to lose weight without being laughed at? You're 30% body fat at 270 pounds after LP. More important thing is, why are you paying somebody to coach you who you don't feel comfortable telling your actual goals, right? Ooh. I buy your Whey RX regularly. Would you say it's less than optimal for me to take 1 scoop of Whey RX and 2 to 3 scoops of another protein to increase my daily protein intake? I mean, maybe. But if you compare that to not getting enough protein in, what are you going to do? Not weigh? Right? So, excuse me. Hey Jordan, I'm about to start the 4-day hypertrophy program. I noticed there are no direct shoulder exercises such as lateral or rear delt raises. When do you add those in, or do we need them? I don't think you need it on that program. There's a lot of pressing work, So you'd be okay. Are energy drinks harmful? Not necessarily. They are full of vitamins. Some of them are. And you said that we should not, in general, supplement vitamins. That's true. I think, the poison's in the dose, right? Do I think Doug Young was GMO? Genetically modified? Nah. Why do I get nauseous and uncomfortable after drinking protein? Well, I don't know. Do you have a protein allergy? A dairy allergy? That would be the question. Oh, man. GMOs are yummy. Yeah, I think so. I'm looking for extra GMOs. Not like just the ones that want more attention, but, add extra ones. All right, I guess that I've been here for almost 40 minutes. So, yeah, I think I'm going to go so I can get up to the airport, or near the airport, and